Hello, I'm Sinawo Faki from South Africa. I am a GBV and domestic violence activist. I went through an emotional trauma during the days whereby I was a victim of domestic violence. My experience didn't limit me, but it made a good impact whereby now I am motivating other victims. I am educating children from the children homes, children from schools about domestic violence and GBV. I am educating government employees about the importance of domestic violence. I am educating the communities based on crime prevention. My take at the CDC Africa is the importance of mental health issues based on lived experience. I will implement everything that I learned in order for the survivors of domestic violence in South Africa to be able to receive healing, to be strengthened, and to influence policies makers, and also able to implement the changes that are needed to be included on mental health in South Africa. I thank this opportunity because it also created a value in me whereby now I am willing to change others. I am willing to heal others based on the information that I have received here.
Sobre a importância de fazermos pesquisa no nosso país. E uma das coisas muito importantes que faz com que os governos, os sistemas, os apoiadores, os parceiros vejam que existe um problema é havendo pesquisa. Através da pesquisa, nós vamos conseguir reunir dados suficientes para que haja atenção a esse problema que é a saúde mental em Angola. Então, com todos os fellows, ou todas as pessoas que têm estado a participar aqui, não só eu, mas todos os outros, temos estado a conversar sobre reunir a comunidade, não só os profissionais, mas também os advogados juvenis, para que juntos consigamos então dar resposta a esse problema.
Okay. Hello everyone. My name is Pamidzai Violet Chogara. I'm a person with lived experience of mental health disorder. I've got bipolar. I come from Zimbabwe, and I've had the opportunity to come for the mental health leadership program, which has widened my scope, my horizon, and has helped me in how I can advocate further for mental health illnesses. We know we've been taught about using presenting figures in our advocacy work, creating investment cases where we can produce to the people that can help us with funding in order to make sure that people with lived experiences actually make a meaningful contribution in the treatment and management of severe mental disorders, and also to raise awareness to the general public that there are mental health illnesses which can be treated scientifically. That's what I've really learned from this training. It has actually increased my confidence. I am now confident. I now have the courage to go and knock to the relevant doors.
My name is Andrew Serugontale. I'm from Uganda. I am a Jesuit student, a graduate student, and a teacher by profession. During my work as a teacher, I found out that many students were facing challenges that I felt I would be of help. So I began a foundation that I go to different schools, talk to people, talk to young people about their challenges they are facing, and most of the challenges were about not feeling good enough, coming from different backgrounds, and I felt like I would be of help. This course it has helped me a lot to appreciate what the knowledge about mental life, and I felt a desire and a need that I need to apply when I go back in my works, my daily works that I do every day.
The Africa CDC Mental Health Leadership Program was designed to take care of the major challenges in the area of mental health systems on the continent of Africa. So what are these major challenges? We all are aware that across Africa, we do not have the required number of workforce to manage and treat mental health conditions presenting people with mental health conditions that require treatment. So in some database, over 90% of people requiring treatment do not get access to qualified mental health practitioner that can support them in the treatment. So the first challenge we see in mental health system on the continent of Africa is how to take care of this treatment gap. Now, to do that, we do not envisage that our member states will be able to train the required number of psychiatrists or even mental health nurses and other professionals within the time frame that is required. And because we cannot wait, we are now working with several partners, and one of the main intervention is the integration of mental health into PHC. So that's for the first one. And if you integrate mental health into PHC, you'll be able to tax sharing and ensure that quality treatment is available very close to where people who require services are. The second challenge is if you look across Africa, many of our countries still use old and archaic mental health laws and legislation. We do not envisage that we will be able to have a mental health system that is able to take care of challenges in the mental health space if those same mental health laws are pejorative and refers to people with mental health illness in a very pejorative and very discriminating way, instituting stigma and the rest. Therefore, one of the things we're doing is we're supporting some of our member states in ensuring that we are able to support them in updating these mental health laws. Then the third challenge that we see here is in mental health we do not have nearly enough surveillance data that we can use for decision making, we can use for advocacy. Therefore, the need to strengthen data acquisition for mental health health system is very important. That's the third. The fourth one is financing, whether we're talking about domestic financing or partner funding, which is not enough for mental health. Therefore, we see an opportunity where if we strengthen surveillance, strengthen data acquisition, we can also use it for advocacy to strengthen financing of mental health system. Finally, we know we have to use a whole of society and whole of government approach to mental health strengthening. And that, therefore, recently, as you are aware, at the 39th Head of States and Government Assembly in Addis Ababa, the Assembly of Head of States adopted the Africa CDC, African Union multi-sectorial coordination and action document, the common position to be used across the continent for advocacy. So what are we doing in Zimbabwe? All of these things I've discussed requires public health competencies, require leadership, and require advocacy. So we have, as part of the Africa CDC Mental Health Leadership Program, we have a pillar we call the short course for public mental health, and Zimbabwe is the host of this program for the whole of Southern Africa. So we've brought in over 25 participants from all the members, from many of the member states across the continent, where we are. We want to use this opportunity to strengthen them in the understanding of the challenges in the mental health system, and also what are the things they can do to support mental health.